Good evening, all. Today we are going to discuss a case note of Miss Cassandra Kinser, an unmarried woman who has some problems with an assault and urinary tract infection. You are going to write a letter to the GP of the client. So let's go ahead with the writing task right now. This is the writing task. Using the information given in the case notes, write a referral letter to Ms. Kinser's general practitioner. So it is the letter written to Ms. Kinser's general practitioner. His name is Travis Wren, and his address is Penrod Medical Clinic, 172 Penrod, Mooseman 2088. So what you are writing the letter to Miss Travis Wren is for further medical evaluation. Why she needs medical evaluation? Because she has to get treatment for UTI. So UTI follow up with the GP. So this is the reason for further medical evaluation. So we have given some sorts of medical evaluation right now, but further medical evaluation is to be given by her GP. So that is the reason why we are writing the letter to Dr. Wren. So Dr. Wren is the patient's GP, the non-GP. He knows the condition of Cassandra Kinser, the social background, the psychological background, the physical background, everything he knows. Let's go ahead and assess the condition, the background information right now. This is a 32-year unmarried woman. This particular lady got admitted to St. Vincent's Hospital at Darlinghurst following an assault by her boyfriend, which she has reported that there was an assault. So we can say the complaint as lip laceration. This is the reason, number one reason why she has got admitted to this particular hospital, St. Vincent Hospital. On 17 January 2016, she has got admitted to this hospital because of lip laceration. So lip laceration was the first presenting complaint, and she told that this happened because of because her boyfriend assaulted her, and she has not got medical attention for the same. So this is what she has reported to the hospital staff when the history was taken. And she has told that she has abdominal pain, burning with urination for the last several days. So these are the things, these are the additional things she told. So this was the presenting complaints. When she got admitted to the hospital today, she told that she was assaulted by her boyfriend, and that's why a lip laceration is there. And apart from that, she has abdominal pain, and she has been suffering from burning micturition for the last several days. So this is what compliance, the presenting compliance. Now, when we have got the subjective data, we have obtained the subjective data from Ms. Kinser. We just went for further evaluation, whether asked her whether she has vomiting or diarrhea, and she told no, she didn't have any diarrhea or vomiting there. And but she told that she is sexually active and does not use protection, and this we correlated this thing. So she might have sexually transmitted diseases, and this might be this might have caused the urinary tract infection. So it's unclear. The data is unclear, so this is a probability there. The situation is vague, it's not that much transparent. So we have said that further evaluation is needed. And now we don't need this particular thing because social background is known to the doctor, because the GP, she is sexually active. This is also known by the doctor. You know that even though she has admitted this to the hospital staff, you can include these things, but this at no point you should include, because very clear to the doctor, she's a smoker, chain smoker, she has a habit of alcoholism. Then whether she is asked whether she uses any sorts of illicit drugs or legal drugs, she told that no, she denies that allegation. So next, this is the final diagnosis: lip laceration and urinary tract infection. Right now she has these things, we have found out, and the progress, we just assessed the progress, and she told that she's all right in almost all the cases. No fever, no chills, no dizziness, no weakness, no symptomatic problems, no systemic problems too there. And now we have to go with the main thing, though. I need to inform the doctor. So I have given treatment for these things, what I have given and what I have not given. So we need to classify what you have given. You have started antibiotics. You have given the Paradise mouthwash. You have given the pain relief medications, but we have not given this thing. So this is what we have to say. What you have given, the medications, you need to include that. You need to brief that. So yeah. And then what we have not given, we have not given the treatment for the urinary tract infection. She does appear to have infected so we have to give treatment for the urinary tract infection, but her condition is okay. Other than that, it appears to be everywhere it is okay. So she is moving back her home. But we have done one more thing, is that appointment is made with the sexual health clinic, as she is having a suspected sexually transmitted disease too. So an appointment is made with the sexual health clinic. And now we have to follow up with her GP to monitor the antibiotics. The antibiotics are clindamycin and ciprofloxacin. So we have to inform the GP. We have to request the GP that she needs to get her urinary tract infection treated. So this is all the history of this particular patient in detail. Now let's go ahead with the address. Addressee, Dr. Travis Wren. So it's a general practitioner. So the title is Dr. Travis Wren, Puntrod Medical Clinic, 172 Puntrod, Mosman 288. 17 January, this is the date of discharge, date of admission, the same day. Dear Dr. Wren, so the surname, Miss Cassandra Kinser, aged 32. Yeah. Now I have to go ahead with the purpose of the letter. So we have seen the case now in detail. So I think we have got a clear-cut picture what we have to do here. The purpose: I'm writing to update the current medical condition of your client, Miss Cassandra Kinser. So I'm writing to update the current medical condition of your client. So she's your patient, Miss Cassandra Kinser. She requires treatment for the urinary tract infection and further management for lip laceration following her discharge today. So she is going to get discharged today, and she requires treatment for urinary tract infection. So she has urinary tract infection, and she needs treatment for the urinary tract infection. And plus, we have to give further treatment, further management for the lip laceration. So we have two conditions, the two diagnoses. One is the treatment for the UTI, which we have not initiated. The second is the follow-up care for lip laceration. So we have started the antibiotics. So we request our GP to do both things. So two things we are requesting: the follow-up care for lip laceration and the initiation of treatment for urinary tract infection. So both of these things we are requesting her on GP. So rest of the things he knows. And what happened at the hospital, we need to update. Now, Ms. Kinser presented to our hospital today with a lacerated lip, which she reported to have caused by an assault by her boyfriend, and abdominal pain. She presented with two complaints. One is the lacerated lip, and the second is abdominal pain. So now she reported to have caused by assault by her boyfriend. This is a subjective data, so we presented. This is not actually, may be the fact or may not be the fact, but this is what she said. That's why we have said she reported to have caused by an assault by her boyfriend and abdominal pain. So these two are subjective data, and one more subjective data is there. She said that she also said she has been experiencing burning sensation while urination for several days. For several days, she has been experiencing the painful, the burning sensation while urination. So this is what the subjective data. At the time of admission, she has told the staff these things, and she denied any systemic complaint. She didn't say that there is any cardiovascular problem. She didn't say any respiratory problems. So no such problems, no systemic complaints other than this urinary tract problem. So that is the only thing that she has told. She told them some sort of lip laceration, and another thing is that the urinary, apart from this, no systemic complaints were reported by her. But she admitted that she does not use protection while sexual intercourse. This is very important. And she, while collecting history, she told that she doesn't use any safety measures while having physical contact with another person. This is a very crucial thing because we are suspecting STD. So we connect these things together: urinary tract infection, STD, and unprotected sexual intercourse. So this is a very relevant data. Please don't skip this particular data. Now, further observations reveal that her urine is infected, which needs to be treated immediately, and now she needs a treatment for the urinary tract infection. And this is what we have said in this particular paragraph. So the background information is clear. So what happened actually? Why she came to the hospital? What was the complaint? And all these things. So the situation, the presenting things are very clear. Now, after grouping this into a specific paragraph, we have another organized paragraph, that is the treatment. So the treatment for the lacerated lips. So antibiotics, number one, antibiotics. Number two, an oxycodone for pain management. So we have given the treatment. So two medications which we started, the name is mentioned, and the pain relief tablet, that's also we have given. Now the mouthwash for the oral hygiene, so that is also given, and when it should be given is also clearly given. Now we have skipped the frequency and dosage for the antibiotics. If it is better to write the dosage and frequency, because the GP needs to know that. I have not written that thing here, but it is better. It is always better, because you know that other conditions are known by the GP. Social conditions, past medical history, her character, habits, all these things are known by the GP. But what happened in the hospital and what treatment you have given is not known to the GP. So I think we have to give that thing in detail here in this particular area. So it is always better to give the dosage and frequency too. We need to add that too, in order to make this thing more perfect there. Now, once we have given the medication detail, we have done one more thing here. We made an appointment with the sexual health clinic because we suspect the sexually transmitted disease. So we have made an appointment. So what all we have done? We have done, she reported something, we have done some observations, and we have made that she has a urinary tract infection. Her lip laceration was treated by these many medicines, 2 antibiotics, a painkiller, and a mouthwash. And now let's go ahead with the crucial thing, what the doctor has to do here. In view of the above, you can see what is happening above. It would be appreciated if you could attend Miss Kinser at the earliest, as soon as possible, and provide the best possible treatment for urinary infection. So this is the thing that I request you, based on the aforementioned facts, based on the aforementioned data, you as a GP, you need to attend the patient as soon as possible and treat her urinary tract infection at the earliest and give the most suitable treatment there. And one more thing, you have to initiate the treatment. At the same time, you need to monitor her compliance with the ongoing antibiotics. So some antibiotics are continuing right now, so you need to monitor the medication compliance, the antibiotic compliance. So 2 things you have to do. Number 1 is to assess her condition, treat UTI as soon as possible. Number 2, kindly monitor her compliance with the ongoing antibiotics. Now, if you have any further queries regarding Ms. Kinser condition and treatment, please do not hesitate to contact me. Yours sincerely, you have written because you have addressed by Dr. Ren. So the name is there. So we have said it is yours sincerely because I have addressed the doctor as Dr. Ren. So I know the person. So see how I have addressed him by his name. So you are sincerely registered nurse, St. Vincent's Hospital, the hospital name, and the place name. You can add the place name to. Place name is Victoria Street, Darlinghurst. You can add that too if you want. Okay, so that is the completion of this particular letter from the beginning till the end.